Thank you, Mr. Chairman. I want to start with my disappointment in this week's committee process, as I'm upset we're marking up H.R. 1683 without a subcommittee legislative hearing. As outlined in my letter to both you and Chairman Upton last week, regular orders should be followed. The committee should begin consideration of a bill with a legislative hearing in subcommittee, followed by a subcommittee markup before the bill comes to the full committee. And this allows the subcommittee members who have expertise on the relevant subject matter to solicit and synthesize these views of outside experts and the individuals and entities affected by the bill. It also allows for a thorough review and analysis of the relevant policy issues. Today's bill, the State Flexibility Act, would repeal the Medicaid and Children's Health Insurance Program CHIP responsibility requirements enacted in the American Recovery and Reinvestment Act and the Affordable Care Act, which would have devastating effects on low-income women, children, seniors, and the disabled. It's critical that we hear from all stakeholders who represent these populations before moving forward on any potential legislation. I know you said we heard from the state governors in a hearing, but I don't think that that satisfies this requirement. We're here considering another bill that attempts to repeal important provisions of the Affordable Care Act. I guess I had hoped when we moved to the SGR and the malpractice that maybe the attempts to repeal would cease, but obviously that's not the case. The bill today, disguised as giving our states flexibility within the law, does nothing to improve care for Americans. It merely tells states they can kick people off the programs. These protections were designed to prevent states from cutting people off coverage and provide stability to both programs until the full slate of health reform provisions kick in, and now during the economic downturn to also try to protect people in the economic downturn. If these protections are rescinded, the coverage of more than a third of Medicaid and CHIP is at risk. Medicaid was established to serve those with nowhere else to turn. For the last 45 years, it's provided a safety net to millions of Americans in need. It's also the last resort for people who need long-term services and supports. In fact, it covers 70% of nursing home residents and 3 million home and community-based beneficiaries, making Medicaid the primary federal government program for long-term care. Meanwhile, CHIP, a bipartisan effort created in '97, has been nothing but a success story. Because of this critical program, the number of uninsured children in the United States decreased while other uninsured populations grew. Now the Republicans want to allow states to dismantle their CHIP programs entirely, a scenario that is devastatingly clear in the preliminary CBO score. Now, I'm aware of the difficult situation the states are in. Certainly my state is no different. They've had to balance budgets in the wake of decreased revenues and increased need. But cutting health care programs is not the way forward. We must not balance our budgets on the backs of low-income families, children, and seniors. We know the Medicaid program isn't the cause of budget problems. It's the level of unemployment and the lost tax revenues that has caused these fiscal challenges for states. So instead of revoking these MOE provisions, we should be marking up a bill that extends the enhanced FMAP payments to states which expire on June 30th. This was the type of federal fiscal relief that's effective and that was used historically by both Democrats and Republicans in Congress to help states address their fiscal issues, to increase jobs, and sustain safety net programs like Medicaid during economic downturns. I don't understand why all of a sudden FMAP is no longer in vogue. We did it when the Republicans were in the majority. We did it when the Democrats were in the majority. All of a sudden now the Republican leadership has taken that off the table. It's the only answer to the problem for the states, not taking people off the Medicaid and SCHIP rolls. I strongly believe that the true purpose of this bill, which my colleagues on the other side are not going to admit, is the first step towards gutting Medicaid and changing it into a block grant program. These calls to block grant or cap Medicaid under the guise of flexibility and fiscal restraint are short-sighted and dangerous. I know that in the Republican budget that was adopted, that they essentially do this with Medicaid. They make major cuts. I think that what we're seeing today under the guise of flexibility is just another way of moving towards these major cuts in Medicaid that we saw in the budget. I urge my colleagues to oppose H.R. 1683. I think it's very short-sighted and is really going to hurt poor people.